I think professionalism is quite a big concept, one that can mean lots of different things to lots of different people. I think that it includes things like client-centered care, keeping our patients in mind in a very sort of individualistic way. I think it also includes sort of wider value things like care and compassion and offering those to patients unconditionally. I think it involves things like how we communicate with our patients. I think it involves how we communicate with our colleagues as well. I think that it's not always something that's just about how we interact face-to-face with people, but also about how we interact within our teams and interact as a service in order to negotiate how to provide care to patients.
So there's the element of adhering to all the code of conduct and professional guidelines, having boundaries at work within professional relationships, etc., but also bringing the personal, so that personal side of you as a professional. Because I think it's really important to reflect on our own experiences, our own kind of knowledge and skills that we bring to the role, our own gaps in knowledge.
There's something important in professionalism about a culture of self-awareness, of reflection, of noticing when we need to grow or learn more or develop skills in certain treatments more, and having the honesty or the transparency within services to be able to say to our superiors when we have those needs and when those needs need to be met in some way through CPD or through learning experiences.
Professionalism is adhering to the ethical guidelines for your professional body. It's behaving in an ethical way inside and outside of work, because I think that's really important.
Being professional amongst your colleagues is key. I now sort of lead a team in the current job that I work in, and if I'm not seen as being confident or professional, then it can certainly come across to my team members that they then can drop their professionalism, etc. So I certainly have to keep my professionalism up, just to lead by example for my colleagues, and being able to communicate with other professions and treat them with the respect that they deserve as well.
Professionalism is about creating an environment where people are able to thrive in the knowledge that they'll be treated fairly, appropriately, that they'll be heard and listened to, and that they'll be led from a place of strength.
I think it has to start with a knowledge basis. You have to be armed with the knowledge to make the right decisions to start with. And professionalism is what allows you to employ that. So following infrastructure, following guidelines, following a code of conduct, doing everything that might not always sit well with yourself, yet knowing it's the right thing to do, is, in my opinion, a huge part of being a professional within the healthcare paradigm.